All right, welcome back. My name is Ashton. I am your co-host. We are on the Veteran Cancer Talk through the Veteran Cancer Network, and today I have Lacey Pritchard, a USMC veteran and currently going through colon cancer. Lacey, thanks for joining us.
You're very, very welcome. Glad to be here.
Absolutely. So tell me a little bit about you. I know you served in the Marine Corps. What years?
Was in from 2005 to 2009. I joined straight out of high school. Wanted to get as close to grunt as I could get, as weird as that sounds. I wanted to prove myself, and ended up becoming a diesel mechanic and spent a little bit of time in training, and then spent over 3 years stationed in Iwakuni, Japan, which is mainland, which
Oh,
is about an hour south of Hiroshima. So.
that sounds beautiful. Did you get to, get to go and do a few fun things when you're over there?
Oh yes, visiting the castles, going to Chicken Shack. I mean, honestly, there's a lot of little things that are experiences within themselves. I mean, even outside of Yokosuka, there's this little pita place that you find at 2:30 in the morning that it ends up becoming one of those base secrets. And there was lots of those kinds of things. But
No,
I
I
mean,
love that.
loved it.
Now, were you wanting to be a career Marine or just do your 4 years and be like, all right, I'm out of here. I did my stuff. I'm going to go back and be a civilian, or was the goal to, serve, multiple years?
It was just to do the four and get out. Although honestly, I really did enjoy my time in. I was good at being a Marine. It was one of the, I mean, it's definitely a place that I felt like I belonged.
No, I love that. Well, let's go ahead and fast forward a little bit then. So, you got out of the Marine Corps. What did you do post military career?
I ended up going first and getting my associate's degree while I worked a plethora of jobs. I'm a Jill of all trades. I've done everything from waiting tables, doing roofing, electrical tile work. I was worked in the kitchen. I've cleaned houses. I've been a nanny. I mean, just whatever job.
I need you to come over to my house because I got a honey to-do list that my husband has not been going through all the time. I mean, he's great, don't get me wrong, but
I'm
goodness.
actually very handy.
Oh,
Um,
I love that. I love that. So, at what point, in your life did you start not feeling right when you started feeling that there was something kind of off with you?
well, after I got done with my education, I moved to Texas and I started having stomach pains and especially lower back pain. And whenever I would go talk to the doctor about it, even though I had a high white blood cell count in my urine, they always just told me, oh, it's because you have a UTI. That's got to be what your pain's from. They never looked at it for anything, even though I told them I'm not having any other symptoms of it. I know what that feels like. This isn't that. And I had probably rearranged my desk at work 6 or 7 times, thinking it had to have been something I was doing. If I could just get myself to sit right, then I wouldn't hurt anymore. And things just progressively got worse to where I wasn't able to fully lay on my left side. I would try to go to the bathroom and I couldn't. And then when I would go to the bathroom, it would be these thin, barely even there poops. I started sweating at night really, really badly. I'd wake up and my whole shirt would be just sopping wet. Like
Mm.
in, and I was telling my doctor all these things, and I had lost, weight without trying. And by this point, I had actually gained quite a lot of weight. When I was diagnosed, I was about 290 pounds. But yeah, my doctor I told her everything, and she's like, well, let's get you a CT. And I went at 8 o'clock that morning to the Dallas VA, got my CT scan. By noon, they had called me and asked me to come in and talk to her. And by 4 o'clock, I was in the clinic going to talk to her. And she was telling me that I had lesions everywhere.
Mm.
And she was extremely upset. And Dr. Patel, I mean, honestly, I'm thankful that she actually listened.
How long did it take for you to, get that diagnosis though? From the initial visit when you started having symptoms, reached out to the doctor to when you were first diagnosed?
Oh, I'd been telling the doctor about abdominal pain for probably 2 or 3 years, but it was always blamed on something else, especially my weight, which, you
Now,
know,
they didn't offer like a colonoscopy or anything like that?
not at all. It was, I mean, always blamed on being a female problem or being due to my weight. At no point was anything ever possibly related to anything else, or even though I had such a high white blood cell count. Like, I wish they would have ran more tests. Like, that's one of the things. There's a CEA, carcinoembryonic antigen test, and it's not, a end all be all, but it does say when your body is fighting something. And if it's over a certain limit, then I think that that should be a part of anyone's blood test, because it says whether or not your body's hiding something that we should know about. And
And that's not a standard test that they offered you?
nope. And if it would have been, I think, especially after, so many times of me going in and having the same problem and being like, look, if it was really that bad of a UTI infection, I would have had other symptoms.
Yeah,
There
you
would
would
have
have
been
gotten cleared up too with the medications that you were getting prescribed
yeah,
also.
and nothing ever worked. It never changed. And they were like, "Oh, well, we'll just give you another dose, and then don't worry about it. Just finish that up, and you'll be fine." And so they would give me antibiotics and just have me go, and nothing ever changed. And I still would have the abdominal pain. And if they added the CEA, especially with the high levels that it was at, because an average range is usually kind of low, like 20 to 30, anywhere from 50 to 100, I think would be testing level. Mine was 2,300 when I was diagnosed.
Holy jeez.
And that's
That's
the thing.
wild.
If we just were able to catch, if that was just a blood test they would have ran, then I could have gotten treatment way, way sooner. And maybe it wouldn't have ended up being stage 4.
Now, is that specific for colon cancer or is this for multiple
Any cancer.
cancers?
That's for anything. It's for your body fighting something. It could be, it even, detect a hidden bone infection, but it basically says that your body is fighting. And even if something else, even if your body's masking it in other ways, it'll show up there because it's a protein that's only put out when your body is fighting. Like,
Mm-hmm.
Massively fighting, whether it be an infection or, in this case, cancer, like an invasive or destructive cell reproduction. So
Yeah, I find that fascinating because the work that Casey and I are doing at the Veteran Cancer Network is really focused on the early cancer screening, through the MCED test, that multi-cancer early detection of blood screening. I'm assuming it's probably going to be something similar that they're looking at. I'm not a scientist or a doctor, so I don't, but I do know that the technology is really moving that forward, and I agree with you. Now, does it test for, does it screen as early as stage 1?
yes, that would. The
That's
second that your body's,
fantastic.
it would be. They're a very early detection system. I know that there's other, more specific tests that probably could detect earlier, but those ones, like the one that is specific for colon cancer, wouldn't be useful if you were dealing with, say, leukemia or
Yeah, one of the
bladder
other.
cancer or one of the other ones. So
No, so I know with now with colon cancer being a little bit more of a prevalent cancer that people are talking about, they're offering screenings a little bit younger, because I think it originally was 50 years and now they lowered it to 45 years. Obviously, get rid of the age altogether is what I say. But how old were you when you were diagnosed with colon cancer?
36. I was
So
36 years
not
old. I would have never even been close. And in all honesty, had I waited till 40, I don't think I would have made it if I hadn't
mm,
had a doctor that listened. Because I was never nowhere close to any of the screening ages, and just thankfully she listened. And I'm worried about other veterans having the same problem. They're too young, and doctors being like, "Oh, you're too young to have cancer." Well, that at this point needs to just be not even a thought in VA's mind, because I have a feeling we're going to see more veterans that had, heavy exposures like I did that, led directly to the cancer. And I mean, it sucks. And I think that's part of the reason why it progressed so fast, was because it was exposure induced.
Now you had a few other service members that you served with that also got cancer in your unit, correct?
Yes. We have one that has glioblastoma, another with bladder cancer, another with non-Hodgkin's lymphoma. We had one pass away from stage 4 stomach cancer.
Mm.
There's a multitude of other health problems. I believe one was recently diagnosed with testicular cancer as well. For as small as our unit is, it seems like we're all popping up sick, and not a one of us have even hit 40.
No, that's wild. I mean, and that's one of the reasons why we're advocating for the exposure. Look at your exposure, history, and compare it to what the symptoms that you're having. Because there are so many veterans I mean, you are just one of many veterans that we've talked to that are in similar boats. They're told that they're too young and weren't even offered any testing, offered any screening. And I know, colon cancer is obviously on the rise just in America in general. And I think a lot of it has to do with our diet. We start off eating or drinking coffee in the morning. We finish it off with, a glass of wine at night, So, I mean, it's all that acidity that's causing could cause. I'm not a doctor by any means, but I mean, I would have to say that what we're being exposed to and what we're putting into our bodies is obviously causing all sorts of different issues. Now, I do want to go back a little bit on what you said, because I do think that, and not to play the woman veterans card, but we do have some unique needs, and a lot of it seems to kind of go back either on our weight or our menstruation, as to why we're having these issues. Or if you're a little bit older, it's because you're going into perimenopause. That seems to be like the blanket rug that people kind of get put under, with some of these issues. So, knowing what you were told, what would you sit there and tell a doctor now, when it comes to your story and looking at your symptoms? Because this could be a teaching moment.
Nobody knows your body better than you do. Nobody knows my
Mm-hmm.
body better than I do. And especially at this point, like I know exactly what's going on at all times, and even the ugly stuff. And we live in our own bodies. We are our biggest advocate for it. And so I would argue even more like this is the feeling. This is trying to better explain that it's not, having menstruation problems and things like that are things I've dealt with my entire life. This isn't that. Respect me knowing the difference, because there was a difference. And had I been listened to, my life would be completely different right now. And hopefully, my treatment, everything would be completely different.
So walk me through your treatment. What has that process been like? And tell, kind of people that are, looking at colon cancer as a diagnosis and a treatment, what is that going to look like for them?
Well, I had very, very metastasized cancer everywhere. I immediately, when I got to Knoxville, I was immediately put in the hospital. They gave me a chemo port, which it's covered right now because I just got my chemo pump removed. And so, but I got my chemo port put in, and they made sure they got my blood numbers back up because was starting to become anemic. And within a week, I was put on to multiple chemos. They put me on oxaliplatin and irinotecan and 5-fluorouracil with leucovorin, as well as Avastin, which is a not immunosuppressor, what's the word I'm looking for? It's immunotherapy. And they basically threw the heaviest doses at me at the books, like to give me fair, like the best shot I could was to throw everything we could at it because I was not doing well. And I had an amazing, amazing response, thankfully. And so after 6 rounds of chemo, I was able to start getting liver surgeries where first they sealed up like veins and they burned off a couple of tumors on the good side of my liver. And then they closed off the veins to the bad side to start closing it down so that way whenever it was removed, it would be less strenuous on my body. And that one was interesting because they had to go in through my neck.
Oh, good gracious.
Oh, and I was awake for it. I made a "that's what he said" joke to the doctor, and he was like, "Oh my God, you're awake!" And I was like, "Yeah," because I'm one
Oh
of those
my
people that need
gosh.
extra sedation, and they did not give me enough.
Oh my gosh. And
But
was that at the VA or is that a civilian hospital?
that's at UT,
At
and
UT. Okay.
they didn't. I mean, I didn't say anything. It was entirely my fault. But I didn't feel anything. I was
How is it?
fine
How
that
is it?
way.
Yeah, I'm just curious. How is it your fault that you woke up?
Oh no, I just was quiet. I never said that I wasn't completely like loopy. I mean, it's twilight sedation, so they don't expect you to fully go
Okay.
under. And it's just for me, like I've had so many surgeries that I'd take 2 rounds of the white tubes of propofol. Like I'm like, they count down from 10, and I'm like, go again, guys. And after that one, I actually had 2/3 of my liver removed and my gallbladder removed. And then I had 6 inches of my colon and 1 of my ovaries removed and 39 lymph nodes. And then I had a total hysterectomy after that. And then during or in between those, I had 6 more rounds of chemo, and then I've had 7 more rounds of chemo since then. And there's spots in my lungs, but hopefully we can keep them from growing any bigger. And so hopefully we're just going to stay stable or shrinking and ride this baby out as long as possible.
So how long have you been going through chemotherapy?
Since January of 2024.
That's a long time. That has to impact you and, emotionally, your family. I mean, how have you been able to kind of keep going forward? Because this is a very real thing that happens to a lot of other people. And I know mental health, especially in the veteran community, is it's a tough one.
Part of it, I is trying to disassociate and focus on other things, like work to make it where other people don't end up in the same boat I am, other veterans don't. And part of it's focusing on my family, and I mean, it's tough, but I can't change anything. I can just do the best with what I've got.
Gotta roll with it.
Do as much I can with the time I have left.
So let's talk a little bit, because obviously you and I have talked offline quite a lot, and one of the things that a lot of our veterans face going through chemo is something called ghosting. I know you're familiar with it. How do you handle that when somebody, is just not wanting to, talk with you anymore, because it's scary to talk to somebody that is going through cancer?
I try not to take it personally. I know some people do it for their own mental health, and it's something that they need to do. It seems like the people that are meant to be here, the ones that do show up, are the ones that need to be and are meant to be. For the people that ghost, I mean, I appreciated their roles in my life, and I still care about them, but I can't force any relationship, and I'm not gonna hold any hostility for it. Like, I mean, I'm hurt, obviously. There's a lot of friends that just, I don't know, disappeared, absolutely ghosted, and I hope they're doing well. I mean, I know for some people it's, I'm a reality that they could, don't want to face, or a the side of the world, an ugly truth that some people don't want to have in their lives.
Now that Casey's post chemo and treatment, I mean, he's still going through his assessments and all that. We've actually talked to some of the people that did ghost us during that time. And for us, I always wanted to know, it's like, why did you stop talking to us? It's like, you could have just sent me a funny meme, you could have just, instead of asking me how my day is, just send me just send something, something like that. And a lot of the times they just didn't know how to talk to us, because they knew that there was a scary diagnosis, and, it was I think it was more scary on their end, because they didn't want to offend, a lot of the time. So it's just easier to kind of go off into the distance and, go hide in a corner and all that. But it definitely does hurt when people do that. But just know that a lot of it, yeah, it sucks, but it's a lot of the times they just don't know how to communicate, So what are some of the things, if one of your, friends that, you haven't talked to in a while, sees this and wants to be able to reach out, what's a message that you would like to be able to hear? Or you say, fuck it, I don't want to sit there and listen to him at all anymore.
Just, I don't know, send me a song that makes you happy, or, just a funny memory. Like, it doesn't have to be, how are you doing? Get an update on everything that I'm going through medically. A lot of people don't want to know, and they don't need to know, and that's totally fine. It's just acknowledging my existence, and, basically acknowledging that I'm still here, that I'm alive, and every day just fighting. Every day.
You're a Marine, though. You said that you wanted to be able to get as close to infantry as possible. And here you are literally fighting for your life. I mean, you were a freaking kick-ass Marine. I will say that I absolutely love having conversations with you on the phone. And for anybody that's listening, I know this is kind of like a heavier topic, but Lacey is the funniest person that I know. I mean, she is able to, take these conversations and like roll with it and make me feel like I'm having like if I'm saying I'm having a shitty day, she's like, fuck it, I'm going through cancer, and I'm like, okay, good, valid point. But no, her humor is just absolutely amazing. So, but kind of going back a little bit, when you were talking about those pains, and everything, and a lot of people don't, understand, like when Casey, he had the throbbing, sometimes sharp pains in his back and all that. or symptoms that, he would not have attributed to his testicular cancer. What are some of the symptoms that you think that are just completely wild that you had no idea actually was a colon cancer symptom?
The night sweats for sure. Because that one like came out of nowhere, and it was so very, very. I mean, it's a telltale sign for a lot of cancers, and so I think anybody who has that level of night sweats, if it's not something that's been lifelong, immediately go to the doctor. Like, and especially if it's attributed with any kind of weight loss, it doesn't matter if it's been a couple of months, it doesn't matter if it's been a while, and it's you know 10, 15 pounds. If it's happening without you trying, if you're experiencing night sweats, if you're, I mean, having that nausea first thing in the morning, I would say definitely go to the doctor, because there's a lot of things that can cause, other problems. And so either way, talk to your doctor, even if it is just polyps or hemorrhoids or something. I mean, I know it's talking about your butt can be uncomfortable. I understand talking about poop can be uncomfortable. But the reality is it's the second highest, colon cancer is the second highest killer for both men and women. And it's affecting people from, I mean, we've had kids in the group. It's getting people of all ages. We're more and more every day. I see people younger and younger in their 20s. And so it's not an old person's disease.
It's
There's
anybody's.
people, there's people that are vegetarian. There are people that have never, drank in their life. It seems to be kind of ruthless with who it picks. And then it's a great pretender as well, because it likes to show up other places. Like for me, it was my liver and, and my reproductive organs and lymph nodes. For some people, it's lungs. It can get into bone. It can get into brain. I mean, it can show up on your skin. It can show up as skin cancer. It's the great pretender. It'll show up and pretend it's something else, but it's all adenocarcinoma.
That's crazy. Now, I want to talk a little bit about some of the resources that you found, especially the one that Facebook group that you're a part of. Tell me, or for those that are going through it, how do they sit there and find a resource that's going to be beneficial for them through that Facebook group that you mentioned?
Well, there's one that was a Facebook group, and it's kind of went a little bit offline into its own group. And that's Colon Town. It's went into its own messaging system where it has different groups, whether it be for a caregiver, whether it be for people of a younger. There's one for military veterans. There's one for um spouses, to where or that are going through it. There are different. I mean, ones who have liver issues, ones that have spleen issues. Like the one for liver is called Liver Lovers Lane. Like that's what the little mini group is called.
That'd be a good
And
shirt.
yeah. And so, I mean, it's one of those places that everybody can talk to. And there's even a hospice group, and there's a group for, Over the Rainbow, where for the family members who've lost their loved one. So it's there for during, after. I mean, it's become a whole network, and they have outreach to make sure, if you want to try to get more second opinions, there's lists of doctors that are, focus on or specialize in certain things. There's hospitals that are more willing to perform surgeries, especially on patients that would be considered more at risk, like me. Because, I haven't had that long. I've never been able to keep cancer gone for long enough. Whereas in like Vanderbilt, you have to be cancer free for 5 years before they will even let you be a possibility for a transplant. I don't see that in my future. But there are hospitals that are willing to work with you, especially if you can find donors. There's different, there's the MD Andersons and the City of Hopes and, all these different hospitals everywhere. But there's also a way for people to be able to connect to different specialists to try to reach out about and find out about different drug trials that are happening across the country, whether it be at Hopkins or there's some at Vanderbilt that have, whether it be different drugs or combinations of things with immunotherapies, with different pharmaceutical drugs. They're not exactly chemo, but I don't have science behind this, but there's lots of trials out there. And so these groups are not just a way for you to have somebody to talk to. They're also a way for you to get information. And it's not just the United States. The Colon Town goes New Zealand, Denmark, Australia, Spain. I mean, I've seen people from South America, all over the world. I mean, all connect because I mean, colon cancer is everywhere. Cancer is everywhere.
Yeah, we'll put the link in the comments so people can sit there and see it and easily click on it and find it. Now, for you personally, you said something about needing a living, a living donor. So that would be a partial liver donation, I'm assuming, from the donor, and then you would be able to receive it. What blood type are you?
I am A positive, and
Okay, and if
I,
somebody's interested and wants to kind of go through that process, I personally went through it before Casey was getting testicular cancer. It's a humbling experience, and it is 100%, obviously voluntary. It's a long process, but I know it means the world to people like Lacey. So if anybody is A positive, or I don't know all the conversions, on the different, blood types that are out there, but reach out to us. We would love to be able to connect you with Lacey's case manager to see what that process might look like. I know
yeah,
107 Foundation does a fantastic job of being able to connect veterans. That's not something that we technically do here at VCN, but Lacey, you're basically family now. So
thank you.
now let's go ahead and just talk a little bit more about some of the fun things that you have going on. I know that you're a mom, and that you obviously are taking care of one smart kid and everything. So what are some of the fun things that you guys do? I mean, it's that conversation with kids. Obviously, that's a whole other thing. So what do you do to be able to kind of, one, normalize that conversation, but two, to give her those memories that, like, hey, mom's still here, because she's preteen, right?
Yes.
Oh, good
She's
luck.
11 going on 36. And she's amazing. I try to spend as much time with her as possible. We go out and go tubing. I'm gonna try to get her back into horseback riding because that was one thing that we did a lot of when we were in Texas. And honestly, right now I'm struggling on the idea of having her do virtual school because it's one of those damned if you do and damned if you don't situations. Because if I keep her in school, there's a greater chance that she can bring me home a sickness that will decimate me and send me into the hospital again. Or does she not go, but loses that peer support network that I think is going to be extremely important to her? And, you know, I think being able to go to school and being around people your own age is important. So, but we are going, I mean, this whole summer, we're going to Dollywood. We're coming to DC with you to lobby and explain exactly from our point of view how, absolutely destructive cancer is and how it's affected our family and as veterans and how I know it's affecting others and how it's going to be affecting others. And we can use our voices to try to change as much as we can. And then we're going to be going and visiting friends up in Michigan, Dr. Eric Fretz. We do a vet reunion kind of some of the alumni at University of Michigan, and we all get together and just, reminisce about good times and catch up on how everybody's lives are doing because everybody's, spanned out all over the world now. So it's a nice way for us to reconnect and, still, have those very strong veteran connections. Because I feel like whether it be with your local VFW or through a school, I think that as a veteran, it's really important to maintain those connections for our sanity, honestly.
I will say isolation is definitely real in the veteran community, especially when I got out of the military. I didn't want to participate much in the military community, and I struggled hard. And it was finding that military community, especially when Casey was going through cancer, that really helped me out. So, I mean, that's solid advice. I absolutely agree on being able to, what do they say at boot camp when you're marching, reach out, ATT, reach out and touch somebody, and it definitely relates still in the military, post-military career is finding that community and finding your tribe, or just finding your tribe in general. It doesn't have to be military. I mean, it just, finding your tribe.
True. I guess just for me, I don't know. I'm sure I'm not the only female Marine that's been told, that we're a little intense.
Don't talk to my
And can
husband.
be
He'll sit there and probably agree
intimidating.
with you on that.
Can be a little intimidating. I've heard that more than once. So,
That's all right. I mean, I definitely felt that with my oldest whenever we were going through schools, because obviously there was a big age gap between my youngest and my oldest, and so I was going to like the schools, and all the other moms were one a little bit older than me, but as soon as they found out that I was a Marine, that I was still in the Marine Corps, they kind of immediately exited stage right. They're like, I don't want to deal with that woman, you know. So we're friendly, I swear. But no, I understand
we're
that.
just great shots.
Yes, exactly. Oh goodness. Well, Lacey, before we hop off and I do my closing, is there any other things that you want me to ask or bring up, or any other parting words?
No, my biggest thing would just be advocate for yourself. Don't be afraid to tell the doctor all the gross things. And you're not going to shock anybody. Trust me. They've seen a lot worse than anything that you can say to them. And they're not judging you. They're not cops. They're not going to turn you in. Tell them what's wrong. Be honest.
I think talking about uncomfortable situations, for people that are not doctors, doctors hear everything.
Yeah.
You come in with that stigma, so it's okay to sit there and talk about how your butt hurts, your stomach hurts, my freaking testy grew. I'm
Yeah.
not my testy. I don't have any testes, but freaking grew 2 times the size, or whatever it is. Doctors hear it all the time. Just get on one of those like TikTok reels of nurses and doctors, and that'll sit there and clear a lot of that up. But you're right, get tested, get screened, speak up, advocate for yourself, because otherwise, I mean, you might be in a situation where you're literally fighting for your life and having to sit there and argue with doctors to be able to even get seen. So
And pay attention to pain that doesn't make sense. Like, it's one thing if you're, working all day in the yard and pull your back, trying to move pavers while you're fixing, the patio or whatever. That's understandable. But if you're like hurting while you're sitting for just sitting and it's been that way and you can't remember the last time, like, there's no legitimate reason for your pain, bring that up. It's not normal to just hurt. Like, I mean, even with age, yes, there's certain extent that we have, knees and back. But I mean, some things aren't normal. Like, if just sitting hurts you, if changing normal positions hurts, tell your doctor. Like, gritting your teeth and bearing it is not a good thing anymore. It's not, being tough isn't cool. Getting you closer to checking out.
pain is weakness leaving the body. That's the biggest falsity I've ever heard.
Yeah, no, pain is your body trying to warn you something that is wrong.
I
Something's
love I
wrong.
loved that marketing as a kid. Whenever I was sitting there seeing the Marines wearing that shirt and everything, and I'm like, yeah, that's awesome. No, it's I mean, it's a great marketing tool. I'll give the Marine Corps that, but talk about compounding trauma, physical trauma and everything. How often did you sit there and not want to go to the doctor at boot camp because you twisted an ankle, and I was like, I'm not getting dropped.
Yeah, exactly. And
Oh
that's
goodness.
the way the whole way through. And I know, I mean, especially with the Marine Corps, I don't know how much so for with other branches, but going to medical was frowned on. Like, it was looked at like, I mean, even for the worst of problems, it was like, oh, you're going to medical, and then you were judged harshly for it, and sometimes punished for it. Like, oh, cool, I got to pick up an extra duty now. Awesome.
I mean, I really hope that that's changing. And for those that are still in the military, I please let us know in the comments if that has changed. But, back whenever, and I say back in the day, good gracious, but when I was in 2007 to 2015, I mean, you're right. It was frowned upon if you go seek mental health help, and I think that is changing. We are seeing a change in that, but the physical health, absolutely. We used to be told all the time, oh, you're a malinger, and I'm like,
Yeah.
that God, that was such a stigma. It's like I did not want to have that badge of, on my chest. But it's true. I really do hope that the military is changing, being able to go and get help, before it gets worse. Cause I'm all about prevention versus intervention. If you go and break your leg, you're going to go to the doctor and, get it fixed. But for whatever reason, these invisible injuries, whether it's mental or, a physical invisible injury, I mean, it is so frowned upon just to be able to get out for help. And so you bring up an amazing point, on that. All right. Well, Lacey, thank you so much for joining us on the Veteran Cancer Talk here at VCN. I know I'm really excited to see you in DC here in just a few weeks, but please take care of yourself. If there's anything that we can do for you at the VCN family, please let us know. We're rooting for you. We're rooting for your daughter, for your whole family. And for those that, have ghosted, their friends because of a cancer diagnosis, send them a happy song, sit there and just check in saying, hey, I was thinking about you today. I stubbed my toe, whatever. Just something to sit there and make them, know that you care. It doesn't have to be serious talk. Lacey brought up a good point. But Lacey, thank you so much for joining us. We loved having you on the show. And, please feel free to come back.
Absolutely. Thank you so much. And I hope you have a wonderful afternoon, and tell everybody I said hi.